I came across a healthcare news story that is very interesting and sad at the same time. And it shows how people can put money over health or ethics. And so let's dive right in and see what this story is about. All right, so I came across a story and it's on Forbes that $12 million dollars in medical fraud put patients at risk. It happened in a Alaska-based clinic where underdose injections with free or expired drugs and billed for full doses. Now the doctor who was calling the shot is in jail. So this is a sad story and a scary one. So it happened in a rheumatology clinic, um, you know, seeking relief from chronic pains, painful conditions like rheumatoid uh, arthritis, arthritis, and many believe that they receive cutting edge injectable treatments designed to slow the progression of their disease. But it turned out that they were being abused and scammed, really. So they believe they got these cutting edge injectable treatments. Many of the injections were not what they seemed. So I'm not going to say the doctor's name, but this physician was sentenced to 6.5 years in prison for fraud. More than a decade, generated over 12.5 million fraudulent insurance claims. Uh, the physician's husband, who helped manage the clinic, was sentenced to 3 years probation, including 2 years of home arrest. So prosecutors said that starting in 2009, this occurred. The couple billed insurers for thousands of dosage of expensive medications that were actually never purchased. Instead, patients received free samples, expired drugs, different medications than prescribed, or less than full doses. Sometimes they were injected with substances they couldn't even identify, while the clinic billed as if the full doses has been given. This is insane. This is crazy. Um, because healthcare is a different type of business. There's different businesses, you know, there's fraud, there's different things that occur in businesses, but healthcare is different because you're really dealing with people at their most vulnerable state. And, losing trust in that, someone will take advantage of you at your vulnerable state where there's that trust that they want you to get better is kind of crazy. It says, how significant was the underdosaging? Well, one instant, the clinic claimed to have administered almost 5,000 units of medication while they only purchased almost 400. Oh my gosh. So I'm skipping the long details of it, but this one's kind of crazy. A part of it, it says that by not purchasing the drugs they billed for, and by underdosing and substituting free or other medications, the clinic created a large gap between the cost and reimbursement. Some drugs billed to insurers generated more than $12,000 per dose. And they continued past the medications scamming. They said that the clinic also billed for lengthy face-to-face visits that patients say never happened. Investigators later found out that dozens of patients were billed for extended visits, sometimes more than 70 or even 115 minutes, despite reporting that their appointments lasted less than half an hour. That's bad. In addition, this is what you don't do to the to the government. Uh, they were making millions off this, and the physician's, I believe, husband took steps to conceal profits, including committed tax evasions. What are your thoughts on this? You know, healthcare organizations are supposed to do right by their patients, um, and not put profits first. This these type of stories scare people, and people lose their faith in the system, the healthcare system. So let me know your thoughts in the comments, and I'll see you in the next video.